1227. That's the number of days I have been living my dream, and each day I have learned and grown as a person while I've walked this journey of a medical student on my way to become a doctor. And in this video, I'll tell you the 10 things that I've learned by spending 3 years in MBBS, which is, according to me, the best course in the entire world. Hi, my name is Anuj. I'm a third year MBBS student at Government Medical College, Nagpur. And if you're new here, welcome to my channel. And without any further ado, let's go. So let's start from the start, right? I was in 10th and I got a very decent percentile of 10 CGPA, which roughly translates to 95%. And if you look at the scores now, you will find that most of the people in the world are getting 95, 96, 98%. And the reason is because the system is so good at making the kids accumulate matter inside them and just regurgitate out in the examination. So what happened was, in our batch also, we saw a lot of toppers, right? Next, I went into my coaching classes, and in those coaching classes, trust me, in the batch of 50, almost 45 people were having a score of more than 92% in CBSE. And I was genuinely afraid because at that time, I was not even in the competition. I was out of the competition as I entered my 11th class. So the story is like that. In the end, after the NEET exam was done, only 2 to 3% of that entire 50 people who were in the class actually made it as MBBS students. And if you consider the entire coaching of like 4,000 or 5,000 people, not even 50 or not even 60 people actually made it to go into some MBBS. And maximum of them are doing something else which they never thought they would actually do. So this is the reality of India. And when I got to MBBS, I got to know about this in the very harsh, very cruel way. That occurred to me that the NEET exam is a good exam. It only selects the top 1% of people, and there is a reason for it. And that reason is because once I entered first year, I understood the gigantic syllabus that is present in our entire course. So in first year, you have 3 subjects. Now, what if I told you that you have to learn every single bone in the body, every single little ridge on that bone, and every single nerve that innervates every single small little muscle in your body? You have to remember the course, and you have to remember which lies first, which lies lateral, medial, anteroposterior. And that's general anatomy, and that's gross anatomy for you in a nutshell. What if I told you have to remember every single tissue and how it looks like under the microscope, and out of the 100 slides kept over there, you have to identify 1 or 2 and specify what is the function of each cell in those tissues? That's histology. Similarly, if I told you that you have to read the most detail out of every single system of the human body, so that's physiology. And every single chemical process that is happening in your body, that's biochemistry. Now, all of that in just a duration of around 10 or 12 months is a huge daunting task. So the reality is the NEET exam is a good one, and it kind of shows you a pre-trailer of what MBBS is. So if you are having very much difficulty with the NEET exam, MBBS is probably not the best course for you. And that is what I recommend to like 50 or 55% of the people who come to me asking for guidance, talking about their dreams and being in this sort of hype that they scored good in the earlier classes, because that hype really just fades away once you go into 11th, 12th. I don't mean to demotivate you, but this is the reality, and this is the first big lesson that I learned just when I entered my first year MBBS. Now, those were only 3 subjects that I talked about: anatomy, physiology, biochemistry. But my friends, if I tell you that over the course of just 4.5 years, you have to master 19 subjects, which are even more bulkier than those, that's a big deal. And that's what MBBS is. It's a very difficult course, which brings me to my second point. There is so much to learn and understand. Like literally in every single class, you're going to go and you're going to pick up something which you never knew. There's not even going to be one single class from a single topic that you've already read that you won't know something else that the teacher will tell you. So there is so much to learn and so much to understand. And it is such an evidence-based field that once a treatment has established, it is not necessary that it will stay in the next year or even the year after that, because we are learning as we are doing the experiments. So even if you are a doctor, you have to keep yourself updated every single year by reading so many books. And that knowledge keeps on growing even after you have ended your MBBS and even after you are established as a doctor. So there is so much to learn and understand, and it is not possible for us to remember everything. And this is my second lesson. So if you're a first year MBBS student watching, or soon to be a first year MBBS student watching this, first of all, you should subscribe. What are you doing, man? Please subscribe right now. Apart from that, make sure that whenever you're in first year, second year, take it slowly, but make sure that you read everything, because all of it is important in some way or the other. The best part about being a medical student is being a student. It's essentially like you're going to school, you're meeting friends, you're making a lot of things together, and you are experiencing a lot of things together, except there are no real rules here. In medical college, it's literally the best thing in the entire world. You go and you experience things which are not in any other course. In first year MBBS, you dissect cadaver. Literally after first year MBBS, if somebody comes up to you in a dark alleyway, keeping a gun to your temple and telling you that give me all your cash, you can literally tell that person the last time you opened up a body, it wasn't so beautiful. And that person would just run away and give his money to you because of the fear. Jokes apart, there are so many experiences that you get in your entire MBBS, right from the dissection of first year to your first case that you're going to take in any single posting to the first patient that you're actually going to treat. It's a big journey and it's so good. It is so pleasing. There are literally not enough words to describe how awesome it feels to be a medical student. Apart from all these academic experiences, college also gives you a gist of life itself. This is the part of your life where you are not really connected with your family as much as you're connected with your friends. So the age between 20 to 30 is the part where you leave your old family behind and you start a new family with your friend. In this phase, you're going to meet so many beautiful people, so many awesome people who are probably going to be remaining your friends for your entire lifetime. Another important thing that comes up with all of this learning and growing and experiencing is as you gradually progress in your years, you feel a sense of responsibility that is, on your shoulders. Like literally physically you feel the pain of all the responsibility that is on you. Currently I'm in third year. I don't have that much responsibilities, but my sister, she's currently a JR1 studying MD pathology in RGMC Thane, and she tells me the biggest thing which is preventing her from taking a leave or doing anything else apart from her work is because she has a responsibility towards her patients. Her patients need her and she understands that. And you start to feel that once you start reading all the diseases from second year. So I'm just going to tell you 2 or 3 incidences actually. So the first one was I was in this post-COVID phase, right? And I was going to my college using my two-wheeler. And there is this big road in Nagpur which is very crowded. So I was going and there happened an accident spontaneously in front of my eyes. There was a guy in a two-wheeler and he got hit by another guy in a two-wheeler. Nobody stopped. Literally nobody stopped. Everybody was going. But I had this sense of responsibility that I need to help that person. I need to make sure that that person is okay. I'm not sure whether it was the humanity inside me or the medical student who has that thing that maybe if there is something wrong, there is some 1% chance that I could save him by doing something, by just doing something, right? So that responsibility inside me compelled me to just keep my vehicle somewhere parked over there in the road, go to that person and just ask him whether are you all right, bhaiya tum theek to ho na? And once that person said that okay main theek hu, help him up with the gaadi and then go back to your own college. It took me 15 minutes extra to reach the college, but I was so happy that that person had not gotten hurt. And if that person would have gotten hurt, I would have kept my vehicle and just helped that person come to my hospital with me. So it is a sense of responsibility. I'm not sure again that whether it was my humanity or it was just the student inside me who had learned so many new things. Waiting to help save a life. The ability to help a person increases by 1,000 folds inside you. Your mind physically warps and you start to see people not just as people, but you actually see them ki okay, we have to help this person. This is something which I've been seeing gradually increase inside me since first year MBBS itself, and it has now reached a point where I feel like no matter what, I have to save lives. And this is, I'm elaborating it too much, but in short, the responsibility does make you a better person indeed. Right, that was a serious topic. Another one is that there is this stereotype going on that med students don't get enough time to do anything. Let me tell you, you do get a lot of time in the first 3 years of your med school journey. In the last one, I haven't experienced it, but I'm sure that you don't get any sort of time because it's finally you have to study a lot of different things and you have to attend a lot of clinics and you have to give a lot of exams. So apart from final year, till the first 3 years, it's awesome. You just get to do anything that you want to do. If you want to go on trips, you can go ahead on trips. If you want to take a leave from college, you can give the proper notice and take a leave from college. If you want to start a YouTube channel, you can actually start to do that and then do all the things that you want in your life while still being a math student. This is a myth that has been circulating. Maybe it's because final year students are spreading it, I don't know, but as far as I'm concerned, in third year MBBS, I just had my prelims practical in the morning. In 3 days, I have another prelims practical. So it's a pretty big deal, but still I'm here making this video, meaning that I do get some times for myself. And mind it, my college is still going on since the past 4.5 months. So I am regularly every single day going to college, not even missed a single day. So you do get time, in short. And I'm also studying and I'm also solving question banks. It is happening all at the same time. So do not believe in this myth that med students do not get time. They do get time. They make time for the things they actually care about. So I gave this example a few videos back, but imagine it this way. If a pretty girl asks you to go on a date, if you're a med student, will you say yes or will you say no? Personally, I would say yes. The reason is I can make time. Of course, I do have time. So if you can make time, you can make time for anything else. Right. The next point is a bit serious one, and it is basically relating to the normal condition of how the doctors are treated in India and how everything else relating to this medical field is in India. So you might have seen a lot of videos about violence and all of that, and seeing that demotivates me a lot. I'm sure it demotivates you a lot as well. But the thing is that the prevalence rate of that happening is not a lot. But I'm not saying that it's not a serious condition. It does happen a lot. But I'm just saying that don't let these videos demotivate you. Build yourself in such a way that these external forces don't affect you. Whenever there is something wrong happening in the society, speak up for it. But don't be afraid to practice or to get into medicine just by the fear of that something of this sort might happen. Another thing is that doctors in India are highly underpaid. Unless and until you are like at the age of 40, 42, at that point you are probably earning a lot of money. But before that, to get up to that point, you have to work a lot. So Dr. Darshan Patel made this excellent video which you definitely should see, in which he basically summarized how the life of a doctor is. So you give NEET UG, you give NEET PG, then you do your MD, MS, and then you take a DM or MCH, whatever you want, and then you are finally a qualified doctor who is entering the field, which will take you like 10 or 12 years of your life to do that. After that, your salary is around 1.5 to 2 lakh per month, depending upon where you're placed, how much you're earning, whether you're doing private practice or not. That's very, very low compared to the amount of time you've invested to get to that point. It increases a lot in 10 years, but the 10 years of your life, which will be before you open up your own hospital, and the 10 years before you are actually an established doctor, are going to be full of struggle for you. In India, if you're a resident doctor who is placed in a central institute in, let's say, Mumbai, right, you're going to get anywhere from 90,000 to 1 lakh, right, for your complete 3 years. And if you compare that to USA, so in USA, a doctor roughly makes around $50,000 to $60,000 in a single year, and that's a lot. So in USA, that translates to roughly around 45 lakhs per annum. That's around 3.75 lakhs per month in USA. I know the developmental score of USA and India is very, very different, but even if you match all of that, the Human Development Index of USA, that is 0.94, and India, that is 0.64 around approximately, you still get a lot of deficit in what it actually should be over here compared to what it actually is. There are a lot of various reasons going into it, but this is the reality. And it is sort of disappointing, because if you are a person who is getting into medicine for the money part, it's going to take a lot. You have to probably hustle a lot sideways, and you have to start your practice early, and you have to struggle a lot if you're not from a family who's already having like a hospital or something. So the struggle is real, and I do feel it because I see my sister and I see her struggle, and literally surrounded by doctors in every single part, and I do feel the empathy for them, because it's difficult financially as well as mentally, because there is so much work that you have to do in any single department. If you go in a week, you have at least 2 call days, so that is an emergency duty of 24 hours. So you have that twice per week. In some departments it's even thrice. So it's a lot of work. Compared to that, the payment is very, very less. That's the sad reality. But this is also another thing which I learned in my 3 years of MBBS. But my friends, the final point is that if you're not in it for the money, if you're financially well off, and if you are here for saving lives, which you will in the future, then in the end, it all just is worth it. If you are truly passionate about, your future as a doctor, you will actually love every single minute of your life treating patients, and you won't really care much about the money, because in the end, even if you're working 24 hours, you are enjoying that 24 hours to yourself. I love this very nice quote, is that if you're doing what you love, you will never feel like you've worked a minute in your life. So the final gist is that if you're really, really passionate about being a doctor, then in the end, once you are that particular doctor, you will feel extremely satisfied with whatever you're doing, whichever field you're placed in, if it's your dream branch, that is. And lastly, to sum up everything, what being a medical student from 3 years has taught me is that I am pluripotent. So pluripotent, this word means that the ability to differentiate into any single cell. So usually you have heard about stem cells, which differentiate into different cells, for example blood forming cells, for example neurons, from muscles. All of these cells, they originate from stem cells. So being a medical student actually makes you that one stem cell who can adjust in any situation life throws at him, whether it's an emergency duty, 24-hour call, whether it's any sort of problems he's faced with, whether it's a continuous back-to-back exams, or whether it is to read all the books in that library in the course of just 4 years. No matter what, that person will feel that he can do it, and the confidence is because he has seen, he has experienced, and he has gained from his journey as a medical student, and seeing so many difficult things and accomplishing them gradually or over and over, it increases your mental willpower to another level, and you feel like you can literally do anything. And if you're a med student, you know what I'm talking about. That feeling where you can do actually anything is great. Lastly, the one thing which I learned is that if you subscribe to this channel, your life will be awesome. Because I make videos such as this one, and also a lot of other vlogs talking about my life. I've currently got a beautiful series going on the channel, the Study With Me series, which you really love. Second one, the Exam Saga, which I'm working on very enthusiastically. So if you're new here, please consider subscribing. It would be awesome. And if you're extremely new to this entire medical field, I suggest you start with my vlogs. It will show you what the actual life of med student looks like. Anyways, thank you so much for watching my video. It's your boy Anuj. I'll catch you in the next one. Stay safe, boys and girls.